So welcome everyone, and thank you for joining us. I'm Sue Sexton from ONEgeneration. I'm the Director of Development and Marketing. For those of you that don't know us, we're a 42-year-old nonprofit in the San Fernando Valley. We're known for our intergenerational programming. We have two locations, a senior center in Reseda for active seniors, which is now temporarily closed due to COVID, but we've pivoted and turned that into a food distribution center. So we have a contactless drive-through food bank there every Tuesday at 10 a.m. We're also doing grocery shopping for seniors, and we're delivering homebound meals to homebound seniors. We're up to 700 meals daily, and that is up from pre-COVID. We were delivering about 275. Our other location in Van Nuys is an intergenerational daycare. We have an adult daycare center there. Right now that is also closed because of COVID, but we also have an infant care and child care preschool, which is still open. We have a farmer's market that we run out of the Joy campus, and that's every Sunday from 8 until 1. We've been doing it for over 25 years, and it's a great way right now to get healthy food and produce during COVID and in an open air market. So let me introduce Paul Davis. He's been a longtime supporter of ONEgeneration since 2003. We honored him in 2019 with our Trailblazer Award, and he's done Medicare training for our staff. He's one of the people we refer to when we have questions about Medicare and Medicare health plans. You've probably seen him advertising in our newsletter. If you're not signed up for our newsletter, you could get that emailed to you every month. Just go to our website and sign up there. And Paul has been named the best insurance agent by the readers of the Los Angeles Daily News for 19 years straight. Also, he's a trusted advisor by the San Fernando Valley Business Journal. Paul was licensed as an insurance agent 36 years ago, and the focus of his practice is solely devoted to Medicare health plans. So it's my honor to introduce you to Paul, and take it away, Paul.
Thank you very much, Sue. So welcome to our educational presentation today. We will not be talking about specific carriers or benefits. It's more of a, here's what Medicare is all about, here are the moving parts, and get some education, be able to make a good decision. We have the annual election period coming up October 15th, and that's the best time to make changes. So hopefully we'll give you some information. This is a new slide I just had put together. I have people all the time telling me that Medicare seems like a maze. It's a little bit of a puzzle. They're a little confused on which way to turn and which way to go, and that's what we do. This is a new advertising theme that I've got going out there, and you can see my associate Jerry is in full mode with that as his background. I already talked about me. This is my associate Jerry. He's been a licensed insurance agent for 28 years. My right-hand man. He is the expert in our office as far as Part D prescription drug plans. And we reshop all of our clients' Part D prescription drug plans during the annual election period every year to make sure they're the best value, they're on the best value. Okay, so why are you here? If you know how to use the chat box, and it's at the bottom of your screen, there should be a pop-up when you go down with your cursor. Just put a little comment as to why you're attending this presentation and what you hope to get out of it. And if you have a chance at the end, give us some feedback and let us know if this is sort of what you thought it would be. I already talked about that, I've been a member of the National Association of Health Underwriters since 1993. And the reason I bring this up is this is my profession. I've been doing health insurance, group health insurance, individual health insurance, Medicare supplement plans for 36 years, and I'm a member of the professional association since 1993. So this helps me if someone is on a group health plan or an individual health plan, I know how to transition them onto a Medicare health plan. I'm very active in the community. Sue mentioned some recognition I received from ONEgeneration. I've got a number of other recognitions. I'm very involved with a number of chambers and nonprofit organizations in the San Fernando Valley. If you have a question along the way, put it in the chat box, and my associate Jerry may be able to answer that question for you, or we'll save it for the very end. If it's something that I just said and you're confused by it, Jerry can come online, unmute himself, and say, Paul, go back and cover that again because no one understands what you just said, or something along that line. Jerry's smiling, good. Okay, so I like this slide. We know the nuts and bolts of applying for Medicare and Medicare health plan options. It is the sole focus of our practice. We do no other kind of insurance, and some people also point out to us that we may have a few loose screws. A number of people have told me that I seem to be the Medicare guru. I have the answers to their questions, and I get other insurance agents calling me, asking me if I know how to do something or the answer to a question. I've so embedded myself in this marketplace that I've become an expert. So everyone we talk to, every single person we talk to, has questions and oftentimes some confusion about Medicare and Medicare health plans. So if you're feeling lost or you're feeling like, I don't get this, I don't understand, you're not alone. Everyone has some level of that discomfort and uncertainty. Okay. If you know anyone or if you're planning on moving, then there's some unique attributes that you should be considering and planning for. If you're a client of ours, we want to let you know, let us know as soon as you know that you're going to be moving, because then we can adapt for that and adjust for that. We suggest that you look far in advance, and if you're going to move someplace, research in advance what sort of health plans that area might have. We have a steady stream of our California clients cashing in on the real estate and moving to other states. So it's good to take a look and see what's going to be available to you when you move. And the fact that you're moving out of the service area in Los Angeles triggers a guaranteed ability for you to move to a new plan in that new location. So plan that move ahead. If you're looking for some resources, my website has a number of different resources you can see here. Applying for Medicare online, the official Social Security website, a quick look at Medicare. We try to include here whatever useful links our clients may need to access on a regular basis. Medicare and You is a booklet that you should automatically receive if you're on Medicare, and if you aren't, you can order it online or download a version of it. It's sort of the how-to manual for all things Medicare. You can find a lot of your answers in this publication. Looks like I hear someone in the background. I think someone's not muted. One of the first things that I like to talk to about is what the costs are for Medicare, because most people assume that everyone's paying the same thing. Most people right now are paying $144.60 a month for Medicare Part B as in boy. But if you have a tax year where your income goes higher, then you can end up paying a lot more in Medicare Part B premiums. It's good to know, and it's also good to maybe plan for your future if you're not 65 yet, to make sure your income falls under these thresholds so you don't pay more in Medicare costs than you need to. If you are above those income thresholds, you are also going to have an income-related monthly adjustment amount on your Part D, whether you're enrolled in a Part D plan separately or it's part of a Medicare Advantage plan. So it'd be the first number plus one of these numbers, depending on where the income correlates. If you think you're paying too much for Part B and the income-related monthly adjustment amount, if you have a life-changing event, you can submit a specific form and appeal that amount. And I run into people all the time that are paying way more than they should. And I ask them, well, why are you paying that much? Well, that's how much they showed. Did you quit working? Yeah, I retired. Is your income lower now? Yes, it's much. Okay, you should file this form and reduce how much you're paying. Medicare is not going to, and Social Security is not going to alert you and let you know. You need to be proactive. And I've saved people thousands of dollars a year if they've just filled out this form. So the Medicare basics, the more you know about Medicare, the more you can understand it and make educated decisions about what plan you should have. What is Medicare? Federal health insurance program run by the CMS, part of the U.S. Department of Health and Human Services. So you may qualify for Medicare generally if you're 65 years or older. And people get confused sometimes with the qualification for Social Security and full Social Security benefits. Those are completely different. 65 years or older qualifies you for Medicare as long as you're a U.S. citizen or been a legal resident for at least 5 years. You can also qualify for Medicare if you're under age 65 and have been disabled for more than 2 years, have end-stage renal disease or ALS. Medicare Part A covers inpatient hospital, skilled nursing, hospice care, and home health care. If you've worked in the U.S. economy and paid taxes for at least 40 quarters, or approximately 10 years, then you should have no cost for Part A. If you have not worked in a way that you paid taxes, and I know some people that have worked under the table or they've had a cash business, Part A may cost you as much as $458 a month. So if you paid taxes, you can kind of say, well, that's sort of my taxes at work. I'm getting something for that, a value for that because I paid in taxes all those years. Medicare Part B covers doctor visits, lab work, x-rays, chemotherapy, radiation therapy, durable medical equipment, ambulance rides, a whole slew of things under Medicare Part B as in boy. And as I said before, the standard amount that you're paying, most people are paying is $144.60 a month. And if you're receiving Social Security benefits, that's automatically deducted from your check. So I talk to a lot of people who don't think they're paying anything for this because they haven't noticed the deduction coming out of their check. You should take a look at that. Not going to go through this slide completely. If all you have is Medicare Part A and B and nothing more, you're going to have some significant shares of cost. And in a hospital stay, it'd be $1,400 deductible that would cover you for the first 60 days. That's actually relatively reasonable. But if you have the misfortune of needing to be in the hospital longer than 60 days, then your cost jumps to $352 per day. And after 90 days, $704 per day, with a maximum number of days in the hospital, 150. So Medicare has some good benefits, but some shortcomings, some co-pays, deductibles, and for most people, it makes sense to layer on Medicare, either a Medicare supplement, a Medicare Advantage, or some sort of employer retiree plan. You must apply for Medicare benefits through the Social Security Administration. You can apply, well, option number one is not really true right now because all the Social Security offices are closed. Most of the people we're talking to are applying online. The trick is they're going to ask you some security questions, and they'll ask you, who did you have a checking account with in 1987? And they'll give you 4 choices. If you don't recognize any of the answers and you go through and you say no to them all, then it's going to say, we have not been able to validate you are who you say you are, and you need to now call someone up and go through a process where they're going to verify you're the right person. So I suggest people apply online when they're fresh and alert and might have the better chance of remembering some of these details. You can also call up Social Security, and they're really busy right now. You're going to spend about typically an hour and 20 minutes on hold to get through to someone. But if you're coming up on eligibility for Medicare, try to do so as far in advance as possible. The 3 months before the month in which you turn 65, you should start looking at it then. So this clearly shows you can apply the month in which you turn 65, the 3 months prior, and the 3 months afterwards. That's your eligibility to enroll in Medicare Parts A and B. So if you turn 65 May 6, your initial enrollment period begins February and ends in August. And you'd think that every month you applied, it would start the first of the month afterwards, but it doesn't work that way. So if you enroll June, your effective date is August 1st. If you enroll July, your effective date is October 1st. And if you enroll in August, your effective date is November 1st. So I've had some people that have gotten tripped up by this and had to pay for insurance that they otherwise wouldn't have had if they'd enrolled in their Medicare at an earlier time frame. There's special enrollment periods, and we most commonly use this for people that are on group health insurance. So we probably get a half a dozen calls a week from people that are in a panic mode. They're turning 65, and everyone tells them that they have to sign up on Medicare right away or they're going to have a penalty. And when I talk to those people, I say, well, what do you have for coverage right now? I've got through my company. How big is the company? Is it more than 20 employees? Oh yeah, it's thousands. Okay. Is the prescription drug coverage considered to be creditable? They don't know what that means, but I instruct them on how to find out. And in most of those cases, I tell people, you don't need to do anything. You don't need to sign up on Medicare. You stay on the group plan until such time as you leave the group plan. And at that juncture, you can enroll in Medicare and whatever other health plan you want. So just because you're turning 65 doesn't mean you need to sign up. And I've had people that have signed up for Part A and Part B and paid the premiums for Part B when they didn't need to. So a lot of interesting things here. So if you leave a group, you have an 8-month time period to sign up for Medicare. I recommend not waiting that long. And also, if you're on a group plan and you leave and go on COBRA, you need to sign up on Medicare right away because COBRA does not work the same as a group health plan. There's a general enrollment period for people that missed out. They missed their 65th birthday, they were asleep at the switch or didn't do the right thing. You'd have to wait from January 1st to March 31st. You can sign up, and then you would start on July 1st of that year. Most of the people that use the general enrollment period end up having to pay a penalty, and the penalty is a 10% penalty for every year that they neglected to sign up where they should have. So we really want to try to avoid having people do that. So who needs to enroll in Medicare? If you're under age 65 and on Social Security disability for 24 months, you automatically get enrolled. If you're turning 65 and you don't have health coverage, or you've got Covered California, you need to sign up when you turn 65. If you're on Covered California and you're getting a subsidy and your cost is very low, be very careful, because when you turn 65, technically you become eligible for Medicare and you lose eligibility for that subsidy. And we've had dozens of cases we've encountered where people didn't find that out until they filed taxes the following year, and then they had to pay back thousands and thousands of dollars in subsidy. So if you know someone that's turning 65 and on Covered California, let them know they need to do something. If you're on a group plan that has fewer than 20 employees, you need to enroll in Medicare, because Medicare in that situation would be considered to be primary and the group would be secondary. Okay. And who does not need to enroll in Medicare? If you're, again, on a group health plan, more than 20 employees, you don't need to do anything. What I find is most people end up signing up on Part A just because it makes them feel more comfortable that they've got some component of Medicare. Signing up for Part A is no harm, no foul. There's no cost to it. I don't think there's a benefit to it, but you have to make sure that you don't sign up on Part A if you're part of a health plan that has a health savings account component, because it's illegal to make contributions to a health savings account if you're on any part of Medicare. So eligible persons can choose additional healthcare options to assist with extra benefit, prescription drug costs, and out-of-pocket expenses. So we're going to talk about, once you've got Medicare, what your alternative options are. So column 1 here is someone that just has original Medicare Parts A and B, and they decide that they want also coverage for prescription drugs. And we recommend, as soon as you become eligible for Medicare, if you don't have other drug coverage, you should sign up for Part D prescription at that time. The second option would be someone with original Medicare, and they decide to sign up on what's called a Medicare supplement plan and also a Part D prescription drug plan. So this person would be carrying 3 cards in their wallet at all times. And the third option is someone that signs up on what's called a Medicare Advantage plan. And in that case, you've assigned your benefits to an insurance company, and you only have to carry this one card from the insurance company because it incorporates other attributes over here. On any of these ways to go, you still have to continue paying your Medicare Part B as in boy premium. So I'm going to talk a little about prescription drug benefits. So currently in Los Angeles, there are 32 Part D prescription drug plans. And when we're helping someone, we shop all 32 Part D plans to see which one produces the lowest total overall cost based on their specific regimen of drugs. These are sold by private insurance companies. The benefits vary so significantly from one plan to the other. They all have to have a basic benefit, but then the insurance companies can choose how to upgrade, what they want to change, which drug is on which tier, what the copays are. There's a myriad of things that they can choose to alter or adjust however they want to in the competitive marketplace. So you can enroll in a standalone Part D prescription drug plan or enroll in a Medicare Advantage plan that includes prescription drugs. Medicare supplement insurance. This is the optimum solution for someone that tells me they don't want an HMO plan. They want a plan that gives them freedom of choice. So if you're on any of the Medicare supplement plans, you have access to any Medicare contracted provider in your city, in the state, in the entire country. The exclusion would be there's going to be some providers that have exclusive contracts, such as doctors that work at Kaiser. You don't have access to them, but you have access to every hospital in the country and about 90% of all of the providers. These plans come with a premium. So I talked to someone that's just turning 65 in California and Los Angeles. Their premium for the top of the line plan would be about $127 a month. My oldest client, who's over 85, is going to be paying right now for the same type of plan about $280 a month. So the cost goes up as you get older. Of note here, 2 plans that were available to everyone as of January 1st this year are only available to you if you turned 65 last year, so or previous years, and that's Plan F and Plan C. So the richest plan currently available if you turn 65 after January 1st of this year is Plan G as in George. The only difference is between G and F is that Plan G has a deductible, $200 deductible, and the premiums are lower. So I know I'm throwing a lot of letters of the alphabet out at you. If you need to talk to me at some later time, we can get more specific and clear up questions you have. But if you're turning 65 now and you want a Medicare supplement plan, you want the richest plan you can get, you're looking at Plan G. Okay, Medicare Advantage plans. With these plans, you assign your Medicare benefits to an insurance company or nonprofit organization, and then they become providers of your Medicare services. So your Medicare card on its own loses any validity. You have to go, everything has to go through that company that you've assigned the benefits to. In Los Angeles, there are 55 Medicare Advantage plans, some additional plans if you have some special needs. 54 of those 55 plans are HMO. Most of those plans include prescription drug coverage, and most of those plans have a 0 monthly premium. So there are literally dozens of plans available in the Los Angeles marketplace that have a 0 monthly premium, includes a 0 copay to see a doctor, 0 copays for lab work, 0 copays for hospitalization. Many people find that very attractive. And many of them have a maximum out of pocket in a calendar year of less than $1,000. These are most suited for people that have been on an HMO plan for a while, have identified a primary care doctor and a medical group that they're very comfortable with, and they want to keep their cost on this coverage as low as possible. Okay, so there are enrollment periods for these Medicare plans. So there's an initial enrollment period, which corresponds to the same enrollment period you got for your Medicare, basic Medicare. There's special enrollment periods. There's the annual election period, which goes October 15th to December 7th. That's what we're coming up on right now. And there's the open Medicare Advantage open enrollment period, January 1st to March 31st. So in the initial, this is for someone that's just turning 65. You have 3 months before, the month of, and 3 months after your birthday, and you can sign up on a Medicare supplement, a Part D prescription drug plan, or alternatively, a Medicare Advantage plan. Guaranteed issue, no health questions, you can't be turned down. Well, there's one health question at this moment. They do ask if you have end-stage renal disease, but as of January 1st of next year, there will be no health questions. There's the annual election period. So this is where Jerry and I, we go nuts. We equate this time period to being like tax season for accountants, because we offer to reshop all of our existing clients. We've got about 1,600 between October 15th and December 7th to try to make sure that they're on the correct Part D prescription drug plan and Medicare Advantage plan. This is the best time for you to look at changing plans. You have the greatest flexibility, make a change, adding a Medicare Advantage plan, adding a Part D plan, or changing those plans. Special enrollment periods, similar to applying for Medicare. If you're losing group health insurance coverage, it gives you a guaranteed right to enroll in a Medicare supplement, Part D plan, and a Medicare Advantage plan. And I point out again here, COBRA plans are not considered creditable coverage. So if you've lost group health insurance and you're going on COBRA, even if the company says, don't worry about it, we're going to pay your COBRA for the next 8 months, you need to sign up on Medicare, because a COBRA plan is considered secondary to Medicare. And if you don't have Medicare in place, you're likely going to have some claims problems. So if you know anyone in that circumstance that got laid off recently, is on COBRA, check with them and make sure if they're over 65 that they've signed up on Medicare. They're working at a fix for this with the federal government, but it hasn't yet occurred. So the open enrollment period, January 1st to March 31st, this is for people that are on a Medicare Advantage plan. They can make a one-time change to a different Medicare Advantage plan, or they can choose to go back to original Medicare, sign up on a Part D plan, and apply for coverage under a Medicare supplement plan. So question that oftentimes comes up, I'm on a Medicare, I want to start with a Medicare Advantage plan. I want to start with a plan that has no monthly premium. And then later down the road, when I start needing more services, then I want to change over to a Medicare supplement plan. Well, you can't always do that. There is no annual open enrollment period for Medicare supplement plans. And other than your initial enrollment, when you first get Medicare Part B, you have a 6-month guaranteed window to sign up. After that, there is no specified guaranteed window where you can sign up whenever you want. So during the annual election period, we usually have a few people that we consult with that say, I'm not happy with my Medicare Advantage plan, I want to go to the supplemental plan. And we say, well, in order to do so, you're going to have to answer health history questions. Here's a sample application of the plan that we think has the fewest questions. Can you answer no to all of these? In some cases, that's true. But if someone is wanting to get off the Medicare Advantage plan because they need surgery or they just got a diagnosis of cancer and they want to do something, they're in most cases not going to be allowed to transition over to a Medicare supplement plan. They will be turned down. There are some quirks in the system. So if you're on a Medicare Advantage plan and it's had some significant changes, reductions in benefits, it may allow you to make a change over to a Medicare supplement plan. Also, if you move out of your service area, say you're in Los Angeles on a Medicare Advantage plan, to another area, that triggers a guaranteed ability to enroll in a Medicare supplement plan at that time. I tell people when they're first eligible to think about the health plan they want, not only right now, but also what plan they want in place 10, 15, 20 years down the road when something significant happens.
Excuse me, Paul. It's 10:33.
Thank you. Okay, this seminar is only going to go for 3 hours. Everyone's good with that, right? No, just kidding. Okay, if you're on a Medicare supplement plan right now, you have a birthday rule in California that guarantees you the right to change to any company's similar or lower Medicare supplement plan within 60 days of your birthday. Most states do not have this rule. So in California, we reshop all of our Medicare supplement clients around their birthday to try to make sure they're on the most cost-effective plan. If you do not enroll in Part D, when you should, and typically when you turn 65 or you come off a group plan, there is a potential late enrollment penalty, and that's assessed, it's about 30 cents a month, which doesn't sound like a lot, but we have several clients that are paying $58.10 a month in penalty, and they will do so for the rest of their lives because they did not sign up on Part D when they should have. If you're lucky enough to be working from a company that has a retiree health plan, there are fewer and fewer companies that offer this. 95% of the time, we got nothing better. We say stay on that retiree plan. The cost is reasonable. The drug benefits are generally more robust than you can get on a Part D prescription drug plan. We'll take a quick look and give you some assessment, but I'm loath to have people change off of these plans because once you leave, you can rarely ever go back. So our humor break, your x-ray showed a broken rib, but we fixed it with Photoshop. Wouldn't it be great if technology could do that? Medicare cost assistance. So if you or someone you know complains that you're having difficulty paying for the cost of your prescriptions or paying for the cost of Medicare, there is help available. So there's extra help, Medicare savings programs, Medicaid, Medi-Cal, and PACE program for all-inclusive care for the elderly. I'm not going to go through these in great detail, but I'm going to show you a couple things. So I know this is kind of small, but if you're single and you're on regular Medicaid, to qualify for that, your income needs to be below $1,294 a month, and you need to have assets of less than $2,000. This is for people over 65. The qualification under 65 is dramatically different, and it's only a function of income. If it's two people, to qualify for both of them to qualify for Medicaid, their income would have to be less than $1,747 a month and assets of less than $3,000. So those are the people that are at highest risk for not having good coverage, and there are programs to help them. If your income is above those thresholds, then you might be able to qualify what's called a low-income subsidy or extra help, and there are several tiers here. So if you're a couple with income resources up to $29,000 and income up to $25,000, you might qualify for a program that would help you pay for your expensive prescription drugs. So if you know anyone that complains that they're not taking their prescriptions because they're too expensive, there might be programs to help them. California also has some Medicare savings programs. They have some different thresholds. I'm not going to go through all this. I have just really sketchy knowledge of this part, so I'm going to choose not to spend a whole lot of time on it.
Paul?
Yes.
I was asking, do assets include your primary residence?
Sorry, that's an excellent question. The assets are only looking at your liquid assets. Doesn't include your residence, doesn't include your car. I think there's a burial policy that can be excluded. It's mostly money on hand, in the bank, in a checking account, in savings, liquid assets. The other thing I like to remind people is if you make use of Medi-Cal after age 55, then eventually when you pass away, the state is going to want to recover back whatever they paid on you. So if you do own a house, be very careful if you sign up on Medicaid, because you may be taking that house away from your heirs. It's a difficult situation, but don't think you're going to get a completely free ride. The state will put a lien on your house, and they will get whatever they're owed when that house eventually sells. They will not force a surviving spouse out of the house, but they will want to get the money eventually. Okay, hopefully that answered that question. If you have done everything you can, you don't qualify for Medi-Cal, you don't qualify for low-income subsidy, we have a number of suggestions we give people on how they can save money on prescription drugs. And we have probably 150 clients that are spending more than $2,000 or $3,000 a year on prescriptions. It's not that uncommon. We use a website called GoodRx, which has some remarkable results for some of our clients. And we have some other resources. So if you are challenged in how to pay for your prescriptions, let us know. We'll send you out a copy of this. This is published by the California Health Advocates. It's a nonprofit organization. We recommend everyone do a Medicare yearly review. And if you're on a Medicare supplement plan, we can give you, here's our published rates of 10 different companies we work with. And if you're 74 and you're on a Medicare supplement plan F and you're paying $350 a month, you might want to give us a call, because looks like we might be able to save you some money. We have dozens of people every year that we save thousands of dollars a year in premium on. They are asleep at the switch and paying way more than they should be on a Medicare supplement plan. So we suggest you shop around your birthday, maybe not every year, but at least every couple of years, to see if there's savings to be had. What's changed in 2020? So Medicare supplement F and C will no longer be available. I talked about this. And what's new for 2021? So a couple of things that I want to point out. There's a new program to cover insulin. And so people that are on insulin, some very expensive products, and many of those are going to be vastly reduced in cost in going into next year. If you have end-stage renal disease, it used to be there were only specific plans that you can enroll in, and now you're going to have a great number of plans that you can enroll in starting January 1st. They're adding acupuncture for back health. Telehealth since COVID-19 has been just the greatest thing since sliced bread, and they're embracing that in Medicare, making it official. So I'm going to talk briefly about Part D, and we're in the home stretch, so not much more to go. If you're on a Part D prescription drug plan, either directly or it's part of your Medicare Advantage plan, this is, I know, very confusing, but there's a cost share of what you pay, what the plan pays, what the drug manufacturers pay, and what the government pays. So the standard Part D plan is a deductible of up to $435 that you'd be responsible for. And then after that deductible, typically you're responsible for about 25% of the cost, but many plans have zero cost or a copay, especially for tier 1 drugs. If you purchase drugs with a retail value of up to $4,020 this year, then you go into the coverage gap, formerly called the donut hole. And at that point, you're definitely responsible for 25% of the cost of medications, for generics and for brand name. Once you've purchased drugs with a retail price of $6,350, then it drops into catastrophic coverage and your cost drops to 5% of the cost of that. So you could have a drug where you have 4 different prices you pay during the course of a calendar year. So this is an area of much confusion for our clients, and we try to help them understand. Mostly, well, this is the more simplistic version of the coverage gap in the donut hole. Mostly we help people by shopping on Medicare.gov. You can as well. And on this site, it'll show you all the Part D plans that exist in your zip code, as well as all the Medicare Advantage plans. You can load in all your prescriptions and compare plans side by side. If this tool didn't exist, we wouldn't be able to help our clients. So the Medicare Advantage plans, again, 55 plans in California, in Los Angeles. You can look for plans that have additional vision coverage, dental, hearing, transportation, and fitness benefits, and they're adding more benefits all the time. So if you're shopping for Medicare Advantage plan, there's some questions you want to ask yourself, whether you're comfortable with this plan. What we see our job is, what plan do you want to go on? Well, what doctors do you want to see? What plans are those doctors contracted with? What drugs you're taking, make sure they're covered more cost effectively. And then what features or benefits are you looking for in a plan that you're going to want to access in the next 12 months? That's how we help people try to decide which plans to sign up with. So we're independent agents and we represent a number of different companies. Star ratings, carriers have star ratings all the way up to 5 stars. This affects how much money they get paid by the federal government. So they always want to have a higher star rating. And that's sort of your counterbalance to make sure that these plans just don't run amok and withhold services. Because if they withhold services and you're not happy and you complain, it can affect their star ratings and how much they get in their pocket. So there are 44 separate items that are measured and then aggregated into a single star rating.
Paul, excuse
Yes.
me. It is 10:43 and there's a question about the donut hole going away.
So technically the donut hole has gone away. It no longer exists. But there still is a coverage gap that exists once you've purchased drugs with a retail price of $4,020. The idea being that the coverage gap, the 25% cost of the prescriptions, is the same as the initial cost. So it's kind of a level playing field. What we find is sometimes when people go into the coverage gap, the cost of their medications does go up. We also find sometimes the cost of the medications goes down. So the coverage gap, in my mind, is still there. Some way of thinking, some people suggest, no, it's not, it's gone away, it's phased out. When Part D first came out in 2006, the coverage gap meant that you would pay 100% of the retail cost of every prescription until you got out of the coverage gap. It's now down to 25%. It's a much better place to be, but it still can be a slightly increase in price. Hopefully that answered the question. You all have preventative services on any Medicare plan you're on, and these are all free. This page is in the Medicare You booklet, and I suggest you print it out, tear it out, take it to your doctor, and ask them what preventative screenings you're due for. Coverage outside of the United States. Most of the Medicare Advantage plans offer some emergency coverage outside of the United States. Medicare officially, technically doesn't cover anything outside of the United States. Some Medicare supplement plans will offer up to $50,000 lifetime. If you're traveling outside of the United States, I recommend for most people they acquire some additional travel accident coverage. If you're turning 65, we got a brochure that can help. If you want to get a rate chart of Medicare supplement plans to compare, we can provide that. So there are a lot of factors to consider. This is the job that we do. We're an independent agent and we're trained to assist you. Jerry and I each go through about 40 hours of continuing education training so we can be certified to talk to you about plans every year. And we offer our services at no cost to you. We get paid a commission if you sign up on a plan through us, and you're paying the exact same price as if you go direct. That's as much of a commercial I'll do. So now, Sue, do you want to see if we can do the poll?
You might want to ask for questions also.
Okay, and ask questions. And if you, the best way to ask questions would be to, well, let's do this first. So the poll is up. You may have already answered question 1 or 2. And if you scroll down, and if you now answer question 3 correctly with not what I expected, exactly what I expected, more than I expected, less than I expected, we'd appreciate honest feedback from you, because we're always looking to improve. I've only done about a half a dozen of these webinars, and I hope to get better every time I do them and give information. Okay. So Jerry, are there questions in the chat box that are of general interest nature that I should address?
Not at the moment.
Okay. And can people individually unmute themselves at this moment? I'm not sure. Okay,
Yes.
so if you have a question, and be careful because 6 people might unmute themselves at the same time, but if you have a question, you can try unmuting yourselves and ask it.
Quick announcement. If you push down the space bar, if you're on a computer, we'll unmute you temporarily.
Oh, thank you, Jerry. I didn't know that.
Hi, Paul.
Hi.
It's Judy Rogg. Hi. I had a ways back when I originally signed up, you had mentioned something about a plan. I can't remember, like when you're turning about 70, a supplement plan, that then it's like it doesn't continue to age rate. The premiums don't go up anymore.
I know exactly what you're referring to. So one of our strategies with all of our Medicare supplement clients, in addition to shopping them every year around their birthday, is we are strategically moving most of them, and I'm not supposed to mention any carriers, but moving most of them to a particular carrier before they turn 75. And then that carrier has had exceptionally good rate stability and doesn't have their rates go up by age more than 2 years. So that you're premature in when that's going to happen.
So it's 75, not 70.
Correct.
Okay, I thought it was 70. I thought it was like between 70 and 71. So
But we
I'm
will,
good for a couple of years.
yeah, but we should still be getting in touch with you every year around your birthday.
Yeah, you
either
do.
To say, we don't see any reason for you to change, or, oh, wait, we should show you this number.
You do, and it's good to see Jerry's face. So I talk to Jerry every year and appreciate the move around with all the drug plans.
Super. Thank you, Judy. Anyone else have questions? Anything in the chat, Jerry? Sounds like someone's having construction done in their background.
Me.
Someone asked about, they're signing up for Medicare Advantage tomorrow. Is that effective immediately or on January 1st?
All right, I'm sorry, repeat the question, Jerry.
Someone's enrolling in Medicare Advantage tomorrow. I want to know if that's effective immediately or on January 1st. And I mentioned that we need to know when her 65th birthday was.
So if you're just turning 65 and it's your initial enrollment and you've signed up for a Medicare Advantage plan to start October 1st, then it will start October 1st. That's the only circumstance which you should be starting a plan right now. If you've been on a plan, you cannot sign up for a new plan until after October 15th, and then that new plan would start January 1st. Does that answer the question?
I believe so.
Okay.
I have a question,
Yes.
Paul. I'd like to know, I want to be able to have the dental included in my insurance, you know, and I only have, I don't have dentals, and I would like to know how I can get that included in my plan.
All right, Marie, I'll send you an email of my thoughts on that in more comprehensive form. I usually tell people, check with, if you have a dentist that you like and you want to continue to see, first chat with that dentist or their office manager and find out what they recommend and what plans they are contracted with. That's the critical word, contracted. And for instance, my dentist is only contracted with Delta Dental Premier. And I've looked at that plan and it's $65 a month. And the most it'll pay out in a calendar year is $1,500. And it has a 12-month waiting period for major work. And I've chosen to say that just doesn't make sense to me.
Okay, send me the email and I will respond, because I know that they're taking a couple of things that I've had before.
Okay.
But that I lost because I wasn't working anymore.
All right. Yeah, we'll definitely take. And Jerry is becoming the expert in my office on dental. So I'll CC him when I email to you. I see a question here. Can you help with continued coverage for my wife on Covered California as I transition to Medicare? And the answer is yes and no. So we used to have someone in our office that worked with Covered California. They have decided to retire, and we did not have anyone up to speed. And we're so busy just dealing with Medicare. We found another agent and agency that we trust and are sending anyone that has a need or interest in Covered California. We're sending them to that agent and agency for assistance. And so far, we're getting great feedback. Be very careful if you're transitioning onto Medicare, be very careful that when you cancel your coverage, you don't accidentally cancel your spouse's coverage that's under 65. That happens occasionally. I tell people, tell the clerk or person you're working with, say it back to me. I want to cancel mine, but I want to leave my wife's coverage in force. Say that back to me and make sure they've got 100% clarity on what they're doing. And there's a question, Paul, when will you be contacting me this year? So I've got a number of clients on this webinar. We send out a package, and it will probably be going out Friday, Saturday, or Monday of next week. It includes the list of drugs that you had last year and our shopping forms to collect current information and send those back. And then we will reshop your Part D prescription drug plan from October 15th to December 7th and make a recommendation that you either stay on that plan or change to a different plan for January 1st of next year.
One more question, Paul, if you see it from Francine.
Yeah, have a spouse that's 68 years old, enrolled in Medicare as of earlier this year, is interested in enrolling in a supplemental coverage. Will the effective date be October? So if he turned 68 earlier this year, if it's been more than 6 months and he was not on a group health plan, then he's missed the open enrollment window to get on a Medicare supplement plan, and he'd have to answer health history questions. If it's within that 6 months of his Medicare Part B, he can still get a guaranteed issue. And today, he can still sign up for an October 1st effective date. Today is the last date to sign up for October 1st. Hopefully that answered the question. If it doesn't, call me later and we'll have a direct conversation. Okay, any other questions? How are we doing on time? Oh, we're almost perfect on time.
So how much more time do I have to see for my insurance so I can get the dental?
There's no time limit on that.
Oh,
It's
okay.
dental is not part of the annual election period. Although we might look at some Medicare Advantage plans that have a more robust dental plan than the one you have and determine whether the trade-off.
I don't have any. I don't have any. That's the problem.
Okay.
Thank you.
All right. We'll be in touch.
Okay, I gotta go, sorry.
All right, Marie. Okay.
Thank you so
So,
much.
how many
Great.
people are still left? Oh, did we get the results of the poll?
There's 17 people left and it's 5 minutes up.
Okay, so let's see what they, so it was exactly what they expected, more than they expected, 13% less than what they expected. Okay, so that's interesting. If anyone's still on the line that it was 13% less, I would very much like to hear from you, either email or give me a call just to let me know what you had expected there to be that there wasn't, so that I know for next time I can do a little better job. All right, so I think that brings us to the end.
Will this be emailed to the people or will it be available?
Sue, I believe you're going to post this online somewhere.
Yeah, so we'll post it to our YouTube page, and then we'll also share it in our upcoming newsletter.
Super. Okay.